Type 2 diabetes changes the body in ways most people never see. A new study from Karolinska Institute shows that the danger does not come only from high blood sugar, it comes from time. The longer a person lives with diabetes, the more their red blood cells begin to harm the very blood vessels they are supposed to protect. This slow shift may explain why the risk of heart attacks and strokes keeps rising year after year, even when glucose levels are controlled. Researchers examined both mice and human patients. At the start of the disease, red blood cells behaved normally. They did not damage blood vessels, but after 7 years, the same patients developed red blood cells that disrupted vascular function. The change was clear and measurable. The cells had lost a protective molecule called microRNA 210. When scientists restored this molecule, blood vessel function improved. This shows that the damage is not random. It follows a biological pattern that unfolds over time. This finding challenges the usual way diabetes is understood. It is not only a metabolic disorder, it is a long-term transformation of the blood itself. Chronic inflammation and oxidative stress slowly alter red blood cells. They become less protective and more harmful. They irritate the lining of blood vessels. They contribute to stiffness and poor circulation. Over years, this leads to a higher risk of cardiovascular disease, the leading cause of death in people with diabetes. The discovery of microRNA 210 as a potential biomarker could change clinical practice. If doctors can measure this molecule in routine blood tests, they may be able to identify patients at high risk before damage occurs. Early detection means early protection. It could guide treatment decisions and prevent life-threatening complications. Researchers are now testing this idea in larger groups to see if it can be used widely. This study adds to a growing body of evidence showing that diabetes is not static. It evolves. The risks grow with time. That is why long-term monitoring matters. It is also why prevention and early intervention are essential. Millions of people live with type 2 diabetes without knowing how their blood is changing. This research offers a warning but also a path forward. If we understand the timeline of damage, we can act before it becomes irreversible. Paying attention early can save lives later.